The medical kit, just like the survival kit, should be built around anticipated, realistic medical issues that you think you could face when you're out in the backcountry. And really the intent of this kit is to take care of minor injuries, so pains, sprains, headaches, and anything above that, anything more critical, to be able to stabilize that patient and get them ready for evacuation out of the field and to a higher level of care. Now, over the years, I've taken an EMT course, a wilderness EMT course, a wilderness first responder course, multiple basic first aid courses, and even a casualty course from the military. And with all that said, I still only feel capable of taking care of basic to maybe some intermediate medical issues in the field. Now, over the years, of course, I've seen some friends have some really scary incidences with broadheads. I've certainly cut myself really bad on one occasion. I've seen frostbite. I've seen hypothermia. I've seen some really severe altitude injuries, so pulmonary and cerebral edema, a near drowning, and even anaphylactic shock from allergies. And every time we either got that person out of the field after kind of taking care of the initial medical issue, or we packaged them up and we waited for evacuation from some other mode of transportation or unit. Now, most of the time, what we're going to face is we're going to face things like blisters, cuts, sprains, strains, headaches, nausea, maybe some hypothermia, dehydration, diarrhea, really the more basic common things that we, even experience at home. And so we want to build the kit really mostly around that to take care of those things so that it keeps us in the field, it keeps us engaged, and it keeps us continuing on, or it allows us to be able to extract ourselves from the field without calling for third-party assistance. Now, it's important that each person carry a medical kit, and in last week's post, I've got a list in the survival kit of the contents I carry in my medical kit. But it's important for everyone to carry one. And then if you're going to treat somebody, so say I'm going to treat my partner, I want to use my partner's medical kit to treat him and keep mine for myself. And so if he's going to treat me, he should be using mine. And the reason is because that oftentimes we're going to separate in the wilderness, and maybe I'm going to sit on a glassy knob, he's going to go on a stalk, whatever the case may be. Or let's say he kills a bull and he's hiking it out of the field and I'm going to stay in for a couple more days. I want to make sure that I still have my medical kit and that it's up to date and it's got everything I need while I'm still out there. Now, the other thing is we want to work out of these kits. So this is something that we're going to be going in and out of throughout that trip. So, hey, I've got a headache, I'm going to take this. Hey, I've got diarrhea, I'm going to take this. Hey, I've got a cut, I'm going to use a Band-Aid. But we want to make sure that we're restocking these kits, and we're also updating these kits as maybe our abilities kind of grow. And so really what I've learned over the years is my kit's not grown because I've gotten more capability. It's actually shrank because I know that I don't really need a lot, that I'm not going to suture somebody up in the field, that I can use my closed cell foam ground pad and some tape that I've already got to splint a broken bone. And so really the kit's kind of evolved, but it's actually shrank in the evolution of that. The other thing is now's a really good time during the summer to go through these medical kits and make sure that they're up to date. So medicines, they expire. Quick clot, it expires and it dries out. Tourniquets have a shelf life. So you want to make sure that this kit is up to date. And although we hope to never use it, if we do need it, that it's there. The last thing I would say is you certainly don't need to go take a wilderness first responder course to be capable enough to run around in the wilderness. But I do suggest that we all take at least some basic first aid courses, us, our partners, so that we kind of have a basic level of medical knowledge so that we can take care of the more minor incidences. And if we do have something that gets a little more severe, that we can recognize that, we can understand that, we can stabilize that person and we can get them out of the field.